Hi. I'm robo-Suzie, and today I'll talk to you about female hair loss and psychological stress. Also, don't forget to check out the link below, to find out how to regrow your hair and prevent further hair loss. I think this is the best way out there. But back to our topic. It seems that female hair loss is manifesting more in young women today than ever before. Female hair loss is of course a very individual process, depending upon several individual factors. More often than not, hair loss generally begins in thinning somewhere around the age of 50 and even later for some individuals, with more of a thinning of the hair at the crown, and may not be a pattern that is recognizable as male pattern hair loss or alopecia. When a woman recognizes hair loss, she may not know whether the hair loss is permanent. There are many different reasons for a woman's hair loss, such as the use of birth control pills, illness, and even pregnancy, as they all have the possibility in contributing to sudden hair loss. However, it is possible that there is only temporary hair loss and there is a regrowth of hair, once a medication has been discontinued or changed. If you are concerned with the thinning of your hair, it is in your best interest to consult with a female hair loss doctor, one that specializes in hair loss treatments for women, to get an expert opinion on the problem, as well as finding a treatment that is just right for you and your thinning condition. Since so many hair loss products have been created with men in mind, women have fewer options than men in finding help for particular hair thinning problems. Women require a different type of hair loss remedy since men and women develop differently. One reason for this is that the body of a woman reacts much differently to illness, stress, and the treatment of hair loss than the body of a man. For instance, you should check your medication to find out that it does not include any progesterone drugs, as they function like androgen. These types of drugs will raise the testosterone levels, which in turn causes DHT to build up while contributing to the cause of female pattern baldness. Always ask your physician if any of your prescriptions include any type of progesterone drugs. Another natural factor that often contributes to the hair loss in a female is the changing of the body of a woman while going through menopause, as it creates imbalance of hormones, which can contribute to female pattern hair loss. Signs of female pattern hair loss. 1. There is an overall thinning of the hair, although it is much more noticeable at the back of the head, where growth seems to be lacking in fullness, or where the hair is growing back in miniature strands of fineness. 2. There is an overall neutral thinning of the hair on the scalp, however it is more noticeable at the front of the head, although it does not affect the national hairline of a woman. 3. There is an overall thinning of the hair on the scalp, however, it is more noticeable at the front of the head while affecting the frontal hairline of a woman. Female hair loss remedies and treatments. Female hair loss treatments normally follow the same approach in treatment as the solutions for male hair loss. Rogaine and alopecia will generally be the first types of medical treatments for female hair loss. Rogaine appears to be the most effective hair loss solution of these two hair loss products. Although there is another drug available for women who have not reached the age of menopause, alocation, as this is used regularly for younger women. For the best results when treating female hair loss after menopause is to combine hormonal replacement medication with alocation. Revivagen and Advicia are both available and offer great results as natural female hair loss remedies. These supplements both include herbs, vitamins, and minerals for hair growth without leaving the user with unwanted side effect while treating female hair loss. Rogaine is one of the most popular of the women's hair loss treatments, and the FDA approves it. Minoxidil is the main ingredient in Rogaine, as it has the ability to aid in blocking the buildup of DHT, which is a cause of female hair loss. However, if you are searching for an answer to female hair loss, you may want to consider natural and ethic hair salons, rather than drugs or surgery for your needs. If you find that your hair loss is in the intermediate stage, you may have the option of using hair braiding or weaving in order to create more volume for your hair, as well as giving you a more natural appearance. Hair loss in women is quite common, as there are many different elements that can contribute to hair loss in females. It is in your best interest to speak to your physician, and remember to ask as many questions as you can think of that will aid you in preventing hair loss. Doing so will help you in educating yourself in the causes for your hair loss, while helping you to understand what choices are right for the best female hair loss treatments. Reasons for female hair loss: 1. Childbirth. 2. Acute trauma. 3. High fevers. 4. Birth control pills. 5. Thyroid disease. 6. Diabetes. 7. Lupus. 8. Medications. Although there are many different causes for female hair loss, the loss of hair can be very traumatic for a woman. However, in the majority of cases, female hair loss remedies can be very effective. Alopecia areata and androgenetic alopecia are the two most common types of female hair loss, and are both treated successfully by female hair loss physicians. However, there is no set pattern of hair loss for the thinning of the hair of a woman. When their hair begins to thin, a woman can feel self-conscious as well as isolated and confined. However, diagnosis of female hair loss can enable you to find the cause of your hair loss while also offering you the option of finding the best hair loss treatment or remedy for your particular needs. That's it. Thank you. Please subscribe, comment and like this video if it was helpful. See you soon.